All right, so we're doing dumbbell cleans for rotators. This probably isn't the exact way that you've seen them done before, but this is the way that I've done them for many, many years. Actually, I haven't done them for a few years. That's probably why I've got a torn rotator cuff in my right side right now, which is why I want you to try these. I think I can even move my right hand. So I'm going to demonstrate with my left hand, and then we'll just see what I can do with my right. So basically what we're doing is, if you were sitting here, you want to sit with, you don't want to be leaning back. You want to be kind of leaning forward, if anything. Flat chest, like you're presenting Superman on your chest. So you're not, forward or anything, but you don't want to be leaning back. Straight up and down. Both hands out to the side. Not going to move that right arm. But if there was someone just like you who was right there next to you, you're going to hit them in their chin with your left elbow, straight up. So you want to go straight up just like this. Ideally, it would be all the way parallel to the ground or somewhat close to it. Okay, you don't want to be shrugging with the trap to get it there. Okay, you want it to be elbow taking it out. With that elbow taking it out, that's the rear delt. And then from here, after you've hit them in the chin, you want to back fist them right in the nose or the forehead and back down. Okay, so it's elbow up to their chin and then a back fist to their forehead, just like that. Okay, you don't want to make it a swing of here and down. That's not going to get you where you want to go. That's just swinging the weight. Make sure that it's an elbow to the chin, back fist to the forehead, and then down. Okay, you want to kind of return to that middle position. It is better with both hands, but I'm not going to push this arm just yet. What kind of weight should you use and how many reps? As far as the reps and the weight, you probably want to be somewhere around at least the 10 rep range. I've seen people use 65-pound dumbbells on these for 10 to 12 reps, 4 to 5 sets. Those are really big benchers, though. That's start with. This is a 2 3/4 pound plate. You can start with a 5.5 pound plate, whatever. Dumbbells are probably a lot easier to hold on to and to manage. But don't worry about being super strict. After you start getting some sets and reps in, it's going to completely set that rear delt, that entire scapula area on fire. And in the process of doing that, it is going to strengthen that front delt or that rotator cuff through the front area as well. Highly, highly underrated exercise. I actually used to do these as well. Instead of being pulled this way, I used to also do them this way as well, from here and in. And that's a different variation as well. Feels a little different in that rear delt, a little different in that lat, and just a little bit different in that front delt as well. So dumbbell cleans for rotators, knock them out so you don't end up like me. This is going to hurt. See, it makes me want to bring that forward. I lose the pain taking the rotator cuff out of it. If I continue to find that spot to where the elbow is in line with my spine, that's where that rotator cuff starts digging in. You're working on that axle clean, the turnover on the atlas stones, axle press and driving your head through. that rotator cuff has to twist. Your incline press, that rotator cuff is going to have to stabilize. Either way, you say, hey, I don't want it to twist. It needs to stabilize. So I'm finding as best position as I can and just trying to move through a range of motion that is on fire but doesn't hurt. Because in a second, I'm going to find a spot that hurts, and it's going to let me know, and I'm going to jump out of my skin. So I want to avoid that. I want it's on fire inside. Good fire, like you're doing 20 rep sets of, I don't know, squats, curls, something. It is on fire inside, which is exactly what I want. So I can't complete the whole rep all the way through, but this is what I can do. So I need the reps of this, and I need to try to get as many reps as I can, as often as I can, without making things worse, without overtraining. This hurts a lot more than I'm saying. That literally just is bringing tears to my eyes. So I've got problems here, so I'm slowly increasing range of motion down a little bit. Trying to stay just ever so slightly out of my comfort zone. And then I need to remind myself I need to stop, come back and do this again tomorrow and not push it today. Because I don't know how sore this is going to make me tomorrow. Which is always smart. You got an injury, something like this that's just small. You end up with back hurts, a lat, a hamstring, a quad. You can generally judge. I've worked it pretty hard today with therapy. You have a pretty good idea what it's going to be like tomorrow. With little tiny things, little itises, an elbow, rotator cuff, you deal with an ACL, something like that. You could do a little bit of work, and once you get it warm, it wants to move. So you keep moving. You say, man, this feels really good. And this is the case with me a lot of times recently. I put a lot of that fire cream on there. Take a couple of Tylenol or an ibuprofen, and I get out here and train, and you know what? It feels pretty decent. About 6 or 8 hours later, I'm in bed, not feeling so great. And the next day, it's so beat up, I can't do therapy work on it again. So you've got to walk that fine line of how much do you think you can do, go a little bit under, come back and do it again tomorrow. That was a big thing with weightlifting. People say, how much should you do in weightlifting? How hard should you train? Only train as hard as you can recover from to train again the next session. If you're only doing snatch and clean and jerk once a week, you train that hard. If you are a professional weightlifter and you're doing snatch, clean and jerk 2 and 3 times a day, you better pull back and make sure you've got enough left for the next training session. Same thing with therapy work, guys.